Listeriosis is the name given to the disease that's caused by a bacteria, and the bacterium's name is Listeria monocytogenes. But we call it listeriosis just to keep it simple. So it's important to remember that most otherwise healthy persons, even if they eat food that is contaminated with listeria, will not become ill. Most illness occurs in patients that have risk factors, and for these patients with risk factors, the most common form of illness is a very mild fever with diarrhea, which is often called gastroenteritis. And that mostly will get better on its own after a few days, and it's likely most people won't even think it's severe enough to go and seek health care for it. The serious forms of disease are when the bacteria gets into the bloodstream and causes a generalized infection throughout the body, and that's called bacteremia. The other serious form is when the bacteria gets into the bloodstream and travels to the brain, causing infection of the brain and the linings of the brain, and we call that meningitis. People who develop those severe forms of disease will often get sick very rapidly, mostly have a fever, and will generally be very ill, and to the extent that they will go and see a healthcare professional for help. So listeria infects people when they eat food that is contaminated with the bacteria. And that's the only way in which people get the disease. Pregnant women, when they become infected with listeria, can pass the infection on to the unborn baby. And that's the only other way in which a human can acquire the infection.